Hey all, this is Professor Fay with your anatomy lesson of the day. Today we're going to learn about some of the cranial and facial bone markings of the skull. So here we go. That's the back of the skull. That's the front of the skull. We're going to start on the front side here. So on the front, we've got the orbit, which is the eye socket. Just above it, the little supraorbital foramen. So supra means above, and then orbital for orbit, eye socket, foramen is a hole. So this is a little hole above the orbit. Then we've got the brow ridge, which is the supraorbital margin. If we look into the orbit, you can see that there's some holes in there. So I'm going to use a pipe cleaner to pass it through the hole so maybe you can see a little bit better which hole I'm talking about. So I'm going to go for the first hole, kind of most superior and medial. That's the optic foramen. All right, there it is, empty, and here comes the pipe cleaner, optic foramen. Then just below it, sort of lateral to it, is the superior orbital fissure, and then I'll just point at the inferior orbital fissure right here. So optic foramen, superior orbital fissure, inferior orbital fissure. Right also here is the lacrimal fossa, which is a little hole that goes through the lacrimal bone and allows tears to pass from your eye into your nose. If we look at the nose, we can see a couple concha. So these more superior concha are actually called the middle nasal concha. There are superior nasal concha, but they're up, kind of embedded in the bone here. We'll see those sort of later with the ethmoid bone. And then there's the inferior nasal concha. So middle nasal concha and inferior nasal concha. If we move over to the side of the skull, you can see the external auditory meatus, which is the hole that sound waves would travel into through your ear. And then just posterior to that is the mastoid process. So if you feel the bony kind of bump behind your ear, that's the mastoid process. And then just anterior to it's a little bit of a fang. That's called the styloid process. If I rotate the skull around, we look at the mastoid process and styloid process, and you can see right between them, there's this little teeny hole right in there. That's the stylomastoid foramen. It's named for both of the processes that it's between. While we're on the bottom of the skull here, you can also see the mandibular fossa, fossae on both sides, which is where the mandible would make the temporomandibular joint. And so temporomandibular joint is your jaw joint over here, right? It is what allows us to open and close our mouth, like that. And so, so the temporal bone is where temporo comes from as part of that joint name. So you can see the temporal bone has a zygomatic process on it, a little extension of bone. And then the zygomatic bone has a little temporal process attached to it. So the temporal process of the zygomatic bone and the zygomatic process of the temporal bone make up the zygomatic arch. So if you travel posteriorly on that arch and then you kind of just rotate the skull, you'll then see the mandibular fossa, again, where the mandible would articulate with the temporal bone to make the temporomandibular joint. On the underside of the skull here, you can see this big huge hole. This is the foramen magnum. This is where your brainstem and spinal cord, the brainstem kind of ends and the spinal cord begins here. And then these things are the occipital condyles. And so your skull would sit on your first cervical vertebra and articulate with them here. If we go a little bit more towards the anterior side of the skull, you can see these two bits of bone that hang down. Those are called the pterygoid processes. So that might be a better view of them, pterygoid processes. That's the roof of your mouth, the hard palate. And so the maxilla makes up part of that. So this is called the palatine process of the maxilla. And then they articulate with the palatine bones and a little suture line in between. Okay. So now we'll move inside the skull. So inside the skull, we've got, I'm gonna first go through the optic foramen again so you can see that from the inside view of the skull. There's the optic foramen, and then I'm gonna move down to the superior orbital fissure. All right, and then what we're gonna do is look at the rest of the foramen. So here is the foramen rotundum, then the foramen ovale, and then the foramen spinosum. So ROS for Ross, the Ross holes, okay? You can also do the Rolls holes if you want, ROLS, and L is for the foramen lacerum that you can see in there. You can also see another foramen kind of next to it, and that's the carotid foramen, or carotid canal. You then have this bridge of bone right here, which is called the petrous region. And if you kind of look at the back of that bridge of bone, you can see the internal auditory meatus, and this big hole is the jugular foramen, where the jugular vein drains the blood from the brain. You can also see the foramen magnum again, this big huge hole, and then kind of on its ridges, right there and right there, are hypoglossal foramen. I think that's all of the foramen that I wanted to talk about through there. Oh, a little bit about the sphenoid and ethmoid bones. So the ethmoid bone is anterior here. We're looking at the face, underside of the face, or the posterior aspect of the face. And so the crista galli is this little sort of fin of bone right here that helps anchor the skull and the brain in place. And then just lateral to it on both sides is what's called the cribriform plate right here and right here. And if you look closely, there are teeny little holes in there called olfactory foramen. So crista galli is a little fin in the middle, the cribriform plate on both sides, and the olfactory foramen. And if we move back here and look at the little animal that's in our skull, we've got lesser wings, and we've got the greater wings, are this big ridge of bone that has a bunch of these foramen on them. So I think of this as like a little pterodactyl in here or something. It's got some wings to it. These are almost like parts of its head or something. And then it's as if a little person could just sit right in there. That's called the sella turcica, which I think translates to Turkish saddle. So I just imagine somebody sitting in the saddle of this little pterodactyl flying around in it. And then the pterodactyl has some little legs. And if you remember, I pointed out the pterygoid processes earlier. That's the sort of the leg of the pterodactyl that hangs down. So hopefully that's a little bit helpful, and hopefully you can envision that. So lesser wings, greater wings, sella turcica. All right, I think that's really it for now.